Hello and welcome to today's webinar. We're so glad to have you. For today's webinar, it's Opioids and Overdose with our special guest, Robyn Litke Sall. This webinar is part of a series. It's free monthly series presented in partnership by Dakota Medical Foundation, Level Up Fargo, and Matto Foundation. And together we're working to delay, decrease, and defeat substance abuse and addiction. This monthly webinar series focuses on youth substance use, the challenges that youth face, as well, and how you can best support them in living to their full potential. So if you're a parent, coach, teacher, mentor, or other caring community member, this webinar series is for you. Be sure to follow us on Level Up Fargo and Matto Foundation Facebook pages for upcoming webinar announcements. Without further ado, I'd like to introduce our special guest today, Robyn Litke Sall. She comes from us from Fargo Cass Public Health, and she has nearly 20 years experience in substance abuse prevention. She's also a certified substance abuse prevention specialist, and we are so grateful to have her serve on our Level Up Fargo Coalition. So Robyn is here to present, and she's going to be talking to us today about preventing, recognizing, and responding to an opioid overdose. And I am going to pass the presentation over to her, and I will let her kick us off and go from there.
Great. Well, good afternoon, everyone, and thank you for joining me today for this very important message and training. Glad you're all able to be here today. We are going to be talking about opioid overdose response, and we are going to be primarily talking about what that looks like in the state of North Dakota, as each state's laws are different when it comes to this. So the objectives for today will be that by the time you're done with this training, you should be able to identify what puts a person at higher risk for an overdose. You should be able to know how to recognize an overdose and how to effectively respond to an overdose, including administering Narcan nasal spray. You'll also be familiar with the relevant North Dakota laws permitting individual use of naloxone and know how to access naloxone and other resources about this topic. Sorry. I think I'll let Andrea help me with this.
Sorry, that's okay.
So first, we're going to talk about some statistics. We're going to take a look at the problem specifically. We'll take a look at what the problem looks like nationally as well as locally. And with this first slide here, this is a look at our national drug overdose deaths that involve any opioid. And that is the years 1999 through 2019. And as you can see, there has been a dramatic increase. Last 2 years ago in 2019, we had nearly 50,000 deaths as a result of opioids. And that just includes opioids and no other drugs. And now we're going to take a look at our local data here in Cass County, North Dakota. This is a look at all of the deaths that we have had since 2013 through 2020 related to opioids. So these are opioid-related deaths or deaths as a result of opioid overdose. And as you can see, we had a very bad year in 2016. And for anyone who lived in the area during that time, you probably remember that was really kind of the beginning of our opioid epidemic here locally. We had a lot of deaths. We had a lot of deaths of young persons. We had, more than one death in one weekend, and it was really bad. But that time was an important time because people in our community mobilized and started to address the issue. And then we also received some federal funding from the state opioid response grant, and we were able to implement widespread access to naloxone in our community. And as a result, in 2017, those deaths almost dropped in half. And then they dropped again in 2018. But unfortunately, in 2019 and in 2020, we did see some increases in those deaths. And our next slide, we're going to take a look at meth-related deaths. And the reason I wanted to share this data with you is because it is the number one, other than alcohol, it is the number one drug-related death cause in our county. And as you can see, in 2020, we had 42 deaths as a result of meth. And so that really is our number one problem right now. And that is concerning because we don't have naloxone or Narcan to help reverse those overdoses like we do for opioids. So that is definitely troubling. And also, when we look at this data, if you take a look at 2016, the opioid deaths were almost double the meth deaths. And then in 2020, we see that that completely flipped around. And we believe that is because there was a lot of effort put towards addressing opioid related deaths. And as a result, we have seen some great strides in that area, but we, at the same time, we did not see, at the same time, we actually saw a doubling of deaths as a result of meth. In our next slide, this shows all of our drug-related deaths in Cass County, excluding alcohol. And this, again, is 2013 through 2020. And as you can see, again, we did have a high number of deaths in 2016. And then just last year in 2020, we had a really high number of deaths. We had 57 deaths. And those deaths were due to drugs other than alcohol. So that would include meth, opioids, and any other drugs, such as cocaine, for example. And then the next slide shows that we have seen increases in Cass County in our drug overdose deaths, but that has been seen really throughout the country. All of the states that are there in red, all of those states had a 20% increase in fatal drug overdoses from June 2019 to May 2020. So there really was a large increase throughout most of our country, not just here in Cass County. And our next slide is alcohol-related deaths. And as you can see, in 2020, we had 72 alcohol-related deaths. And as a prevention coordinator, I often point out to individuals that alcohol always has been and probably always will be the number one killer of our citizens here in Cass County and in the state of North Dakota, because it is a legal drug and because it is very culturally accepted. So that is really our biggest problem that we have here. So alcohol-related deaths are number one, meth-related deaths are number two, but opioid-related deaths, we did see a rise in those, and those are preventable, and that's what we're going to talk about next. So we're going to talk about who is at risk for an opioid overdose. So anyone who is at risk, basically anyone who uses prescription opioids or illegal opioids are at risk for an overdose. And that's even if you're using opioids that were prescribed by your doctor. So there is a risk for anyone. So that's really important to note. And then for people that are at highest risk would be anyone who misuses an opioid. You can go to the next slide. Yep. So anyone who accidentally or deliberately takes an extra dose or misuses a prescription opioid, anyone who receives more than one prescription, anyone who takes opioid medications that are prescribed for someone else, and anyone who injects or snorts opioids is at highest risk for opioid overdose. And also anyone who combines opioids, whether they're prescribed or illicit, with alcohol or certain other medications, especially benzodiazepines such as Xanax, and even some over-the-counter products that depress breathing, heart rate, and other functions of the central nervous system can increase risk. And that could include cough syrup or allergy medications. And also someone at high risk is someone that is prescribed opioids that has a history of addiction or a history of family addiction, or anyone who has an opioid use disorder and has been recently released from detoxification, incarceration, or treatment. And the reason for that is because tolerance to opioids changes very quickly. In fact, it changes within just a few days. So if someone were to be incarcerated, for example, for a couple of weeks, and they were abstinent that entire time, if they took the same amount of opioids that they took prior to their incarceration after they were released, that would put them at a much higher risk for overdose. And in fact, it could even cause an overdose because the body would react so differently because of that changed tolerance. Okay. And also, so next we're going to talk about how to recognize an opioid overdose? What should we look for? What are the signs and symptoms? So as we can see here, all opioids can depress the central nervous system if too much is taken. And so that results in decreased or stopping of breathing effort. And if it's left untreated, it can lead to death. An opioid overdose requires immediate medical attention, and recognizing the signs of overdose is essential to saving a life. So, some of the symptoms that we would want to be aware of, and we'd want to call 911 immediately if we exhibit any of those, or if a person exhibits any of those, would be if their face is clammy to the touch, if it's lost color, if their body is limp, if their fingernails or lips have a blue or purple tinge, if they're vomiting or making gurgling noises, if they cannot be awakened from sleep, or if they're unable to speak, if their breathing is slow or has stopped, or if their heartbeat is slow or has stopped. Now we're going to take a look at the progression of an opioid overdose from start to finish. It starts with ingesting too much opioids for your system. The first thing that would happen is your breathing effort is going to slow. Then you're going to lose consciousness. Then, because of the slowing of breathing, the brain, heart, and body is going to be deprived of oxygen. And once it is deprived of oxygen, irreversible damage can occur to the brain and other organs. Next, cardiac arrest occurs, and then death. So that is what the progression of an overdose looks like. So now we're going to talk about naloxone and what it is. We have a really good picture here of what it looks like in the brain. So if you can see there, those gold and orange accordion looking figures, those are opioid receptors in the brain. And we have lots of receptors in our brain. We have receptors for caffeine, nicotine, and obviously for opioids. The green circles that it symbolizes the opioid. And as you can see, the opioid is sitting on top of that receptor. Well, naloxone is that group of blue circles. What they do is they come along and they kick the opioid off the receptor, and they sit there so that the opioid can no longer cause the effects that that person was having. So it's an antidote, really, or a miracle drug to the overdose of heroin or any other opioid. And it works by blocking the effects of the opioid in a person's system, and it helps restore breathing. Even though this is a miracle drug and anyone can use it, it is important to note that individuals still need follow-up medical care after it has been administered, because there can be acute and even long-term symptoms as a result of overdose. And as we can see here, it's also important to note that naloxone is only effective when the overdose is due to usage of an opioid. And that would be drugs like heroin, morphine, Dilaudid, OxyContin, Percocet, Vicodin, fentanyl, buprenorphine, codeine, methadone, tramadol, drugs like that. It is not going to be effective if the overdose is due to usage of alcohol, benzodiazepines such as Valium and Xanax, any antidepressants, other medications, or other illicit drugs such as methamphetamine. Although you may not know what the overdose is from, it still may be beneficial to administer naloxone. If opioids have been taken with a combination of other drugs, the naloxone will negate the opioid effects and could still save a life.
That's a good point to make.
And again, just some safety points here. It's important to note that naloxone is not a substitute for emergency care. You still want that person to get emergency care. Naloxone may initiate opioid withdrawal. And most individuals that have opioid use disorder usually take an opioid for one of two reasons. Either one, to avoid having withdrawal symptoms, or two, to treat those withdrawal symptoms. Opioid withdrawal is very uncomfortable. In fact, those with opioid use disorder have likened it to feeling like they're dying. Um, so anyways, if we're giving them the naloxone, that is going to kick that opioid off the receptor, and it's no longer going to give them the effects of taking care of those withdrawal symptoms. So that could happen. And you do not want to give it to them if there's a known hypersensitivity or allergy, for example. That is extremely rare. And you should never hesitate to give someone naloxone if you are concerned that they may be in overdose. And obviously, you wouldn't give it to them if they have a known hypersensitivity. But it's important to note that someone would not be taking opioids if they had a hypersensitivity to naloxone, because they would also have a hypersensitivity to opioids. So yeah, I wouldn't let that, scare you too much into not giving it. When in doubt, definitely administer the naloxone. Another thing to note about naloxone is it is not like other opioid drugs. It does not produce a high or a tolerance to opioids. You do not become dependent on it or feel like you need to have it. The other thing to note about naloxone is you want to avoid multiple rapid doses and implement rescue breathing to prevent what's known as opioid overdose associated non-cardiogenic pulmonary edema. But that can be prevented by limiting one dose to every 2 to 3 minutes. So you want to give the dose and then wait 2 to 3 minutes until giving that second dose if it's needed. The non-cardiogenic pulmonary edema is going to happen when someone is given multiple doses, pretty much one right after the other. So that's also preventable as well. The other thing to note about naloxone is that research has proven that access to naloxone does not increase drug use. So those with opioid use disorder are not going to use more just because naloxone is available, and research has already proven that. Limiting access to naloxone only prevents someone from receiving an effective life-saving measure. And if we don't save their lives, how can they ever get into treatment and recovery?
Absolutely.
Yeah. There are 3 FDA-approved formulations of naloxone. The first one is Narcan nasal spray, and you probably have heard the term Narcan a lot and very interchangeably with naloxone. And the reason for that is Narcan is naloxone. It is just the brand name of naloxone. So for example, we have ibuprofen and we have Advil. Advil's ibuprofen, but the brand name of that is Advil. It's the same with Narcan. So Narcan is a nasal spray. It is pre-filled. It does not require the use of any needles. It requires no assembly, and it can deliver a single dose in one nostril while the patient lies on their back. It is so simple and easy to use, and that's why it's available for anyone. And there is widespread access. Anyone can have access to naloxone because it is, or to Narcan, excuse me, because it is so easy for any person to administer. There's also the Evzio auto injector. That is similar to an EpiPen, and it gives directions similar to an AED. So it tells you how to deliver the medication. And then there's various forms of injectable naloxone that can be used intravenously, intramuscularly, or even in a pre-filled syringe for injection into that turns into a spray into the nose with an atomizer. So that can be given intranasally. However, it does require setup. You have to put 3 different pieces together. It's a lot more difficult to use than the Narcan nasal spray. And go ahead, next slide.
Okay.
And here is a picture of Narcan. This is a box of Narcan. In each box, there are 2 doses. And yet, as you can see there is 1 dose. And there is a key there just so you can kind of reference, about how big it is. So it literally is small enough that you can carry it in your purse. So it does not, and actually, if you take the 2 doses out of the box itself, it takes up hardly any room at all. I mean, you could fit those 2 doses right in your pocket. All right. And this is a look at the opioid overdose rescue kit that Fargo Cass Public Health distributes to agencies, organizations, law enforcement, schools, pretty much, widely throughout the community. The opioid overdose rescue kit includes 1 box of Narcan nasal spray. It includes gloves, and it includes a micro shield mouth barrier for giving rescue breaths, which we will cover in a bit. And it also includes an instructions card with 2 sides. One side talks about the steps for responding to an opioid overdose, and the other side talks about how to administer the Narcan nasal spray.
Great.
And for storage, naloxone should be kept at room temperature between about 59 and 77 degrees. Don't let it freeze. Protect it from light. And naloxone shelf life is 2 years. And on a box of Narcan, there will be an expiration date. However, studies have shown that Narcan can be used for up to 5+ years past the expiration date. However, the FDA does recommend disposal at the expiration date. And also, studies have shown that expired or previously frozen naloxone retains most of its potency. So, if you have something that's been expired or something that was frozen and unthawed, you can still use it. Chances are it will still be plenty effective for what you need. And again, there's my reminder: when in doubt, administer. And also, just like with any medication, you want to keep it away from children or pets. All right, so let's talk about the steps to responding to an overdose. So there are several steps. Administering the naloxone is just one of the steps. So we're going to go through those steps. The first one is to call 911 and begin rescue breaths. The second one is to administer naloxone and continue rescue breaths. And the third is to stay on scene until first responders arrive. All right. So for our first step, calling 911 and beginning rescue breaths, first you want to assess the surroundings for your safety. If you're not safe, chances are you won't be able to save their life. So make sure that you're in a safe surrounding. Next, you want to attempt to wake the person. You want to make sure that they aren't just maybe sleeping heavily. And the way to do that is by asking them if they're okay, shouting their name, or just shouting at them if you don't know them. Shake their shoulders, or firmly rub the middle of their
Sternum.
chest, like a sternum rub, and that would be with your middle finger knuckle up and down. That will wake someone that is sleeping soundly, because it's very, very uncomfortable. Okay, next you want to check for signs of an opioid overdose. So if they're not waking up or responding to your voice or touch, if their breathing is slow, irregular, or it is stopped, if the center part of their eye is very small or has pinpoint pupils. And then you also want to check for a pulse. If there's no pulse, you definitely want to do CPR if you are trained to do that. Then go ahead and call 911. The effect of the naloxone is temporary. In fact, it only lasts about 30 to 90 minutes, depending on the individual. And once it wears off, the person can return to the overdose state and is still at risk for death. And just a reminder again, an overdose always requires medical attention.
Absolutely.
Yep. All right, so continuing with step one, you want to put gloves on if available. And if you have one of our opioid overdose rescue kits, we have gloves in there. Then you want to provide 2 rescue breaths using a mask or a rescue breathing aid if available. And to give rescue breaths, you want to lay the person on their back. And just as it shows there in the illustration, you want to put one hand on their chin, tilt their head back, and pinch their nose closed. You want to make a seal over their mouth and breathe into the mouth twice. So the first time you give the rescue breaths, you want to give them 2, because you don't know how long they may have gone without breathing. So give them two breaths. And then after that, it should be 1 breath every 5 seconds. And make sure that their chest is rising when you're giving these breaths and not their stomach. If it's their stomach, you want to readjust them. All right, now for step 2, which is administering the naloxone and continuing with rescue breaths. So again, to give someone Narcan, you want to have them laying on their back, just like they were for the rescue breaths. You want to remove the Narcan nasal spray from the box. You want to take out just one of the doses that is individually wrapped. You want to peel back the tab with the circle, at the back, and that will peel back that foil wrapper that the Narcan nasal spray is wrapped in. Then you want to hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and your middle fingers on either side of the nozzle. And as you can see there in that second illustration, that is how you need to hold it. You want to then gently insert the tip of the nozzle into either nostril. You want to tilt the person's head back and provide support under their neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose, which you will see in that fourth illustration there. And then you want to continue rescue breaths until their breathing effort returns. One breath every 5 seconds.
Good reminder.
All right. Also for still on step 2 here, you want to move the person on their side into the recovery position. And there's a picture of it there after you give them the Narcan nasal spray. Now, you only want to put them in the recovery position if they have started breathing again, or if you need to leave them. All right, so you put them in the recovery position by laying them on their side, putting both of their hands underneath their head, and pulling their top leg out with the knee bent. You want to watch the person closely. If the person does not respond by waking up to voice or touch or breathing normally, another dose may be given, but not until 2 to 3 minutes. All right, now for step 3, which is staying on scene until first responders arrive. So when naloxone is used, the person will likely develop symptoms such as nausea, vomiting, diarrhea, sweating, body aches, weakness, and shortness of breath. Those are withdrawal symptoms from the opioid and are to be expected. However, withdrawal symptoms will not cause harm. They will not die from their withdrawal symptoms. And that's only in extreme cases when the person has become so completely dehydrated that they can that is what causes them to die. So a person can also have different behaviors or emotions upon waking up from an opioid overdose. They could be confused, agitated, sedated, angry, embarrassed, frustrated, sad. So it's just really important to note that they may not be smiling and thanking you the second that they wake up. So just to expect these possible reactions. And I just wanted to point out that there is a video for Narcan nasal spray. It's about a 7-minute video. A large portion of the video is actually the reading off of the product insert, which is very long. But this is a good resource for you if you want to watch watch the administering of the Narcan nasal spray from start to finish. And all you need to do is go to YouTube and type in Narcan nasal spray, and you can watch this video to refresh or to review how to administer it.
Perfect.
All right. So in summary, for overdose response, the first step is to recognize that there is a potential opioid overdose. Next, you want to check for a pulse. If they don't have a pulse, you want to begin CPR if you know how to give it. Next, you want to call 911 to notify medical responders of the possible overdose. Next, you want to give 2 rescue breaths and administer the Narcan nasal spray. And then you want to repeat that in 2 to 3 minutes if their breathing effort does not return. Next, you want to continue giving them rescue breaths, 1 breath every 5 seconds until their breathing returns. Then you want to place them in the recovery position once their breathing has returned, or if you need to leave the victim. That's going to put them in the safest possible position to allow for good breathing and also to safeguard them if any vomiting were to occur. And then you want to provide care until the first responders arrive, and you want to inform the first responders of any interventions that you have undertook. Now I want to talk about the North Dakota laws that protect you when it comes to naloxone. So the first law that I'm going to talk about is the North Dakota Good Samaritan Law. And that law was passed to encourage friends, family members, and bystanders to call 911 in the event of an overdose. And by doing so, you can be immune from prosecution for having drugs or for having drug paraphernalia on your person. But in order to be immune from prosecution, you need to call 911, remain on site until assistance arrives, and cooperate with law enforcement and emergency medical service personnel. Minnesota has a very similar law. So if you are in Minnesota or travel to Minnesota, do not worry about, calling 911. And this next law, Minnesota also has a similar law too. This law says that any individual, anyone, is protected from civil or criminal liability for giving naloxone for a suspected opioid overdose. So you can't be criminally charged or civilly sued for giving someone naloxone. And that is true under North Dakota law and Minnesota law. And our next slide, this I just wanted to show you is an executive order that was issued by our governor. He very much believed in Narcan and naloxone and wanted to make sure that it was available to everyone. So he drafted this or enacted this executive order to direct all cabinet agencies to collaborate with local and tribal governments and law enforcement to make naloxone readily accessible to first responders, individual opioid users, and their family members, and to community leaders. So basically to anyone. And now I want to go through various resources on this topic that are available to you. So the first thing I wanted to point out is that naloxone is fairly readily available in our community. Anyone that's at risk for having or witnessing an opioid overdose can obtain a prescription from a physician or a local pharmacist. So, and I would say almost all of the pharmacies in Cass County do participate in this. It is voluntary. A pharmacist is not compelled to have to write a prescription, but most of ours do, luckily. And so a person can walk in off the street, go to the pharmacy and say, I need naloxone. I have a neighbor, I have a friend, I'm concerned that they might overdose. So the pharmacist will write you out a prescription. They will train you on how to use the Narcan, and then they will sell it to you. One potential drawback of this is that Narcan to purchase can be somewhat expensive. It can be about $110 around that price to purchase it. But luckily, Narcan is available free of charge through Fargo Cass Public Health. So I will provide my contact information at the end so that if you personally or your group or organization, if you're interested in training and receiving free Narcan, we definitely can assist with anyone here in Cass County.
Wonderful.
And I also wanted to point out that the North Dakota Behavioral Health website has a lot of great communication resources about opioid overdose. And as you can see there's a couple of posters, and there's also a pocket card for using Narcan nasal spray. And there's many more resources. And those can be found at behavioralhealth.nd.gov/opioids. All right. And the other thing I wanted to discuss real quickly with you is to let you know that opioids, the risks of opioids include side effects, addiction, abuse, and overdose. And just a reminder that anyone who takes prescription opioids can become addicted to them. So if you or a loved one or even a child about to undergo a dental procedure is potentially going to be prescribed opioids, it is your right to ask for an alternative. It is your right to say, no, I don't want these. So it's important to talk to your doctor about managing pain without opioids. And doctors within the last several years have become really good at finding alternatives to prescribing opioids. So, and it's also important to note that some options may actually work better and have fewer risks and side effects. And in fact, ibuprofen in several studies has been proven to be more effective in some cases than opioids. And obviously you can't, overdose. Well, you could, I suppose, if you took an entire bottle, but it doesn't have the same risk as opioids. So if you want more resources on this issue, go to cdc.gov/drug overdose. And there are dozens of resources there on alternatives to opioids and talking with your provider about that.
Excellent information.
And the next resource here is for parents or professionals that work with children. This website, parentslead.org, is from the Behavioral Health Division at North Dakota, and they help parents and professionals to communicate with kids of all ages from the time they are a toddler all the way through college. And on the screen here are three different resources that I pulled. There are thousands of resources on this website, but here are some pertinent ones for this topic. The first one there is reducing your child's risk for substance abuse, tips for parents, communicating with your child when you suspect substance use, and what the signs and symptoms are of a youth that may be using substances. So head to parentslead.org for a lot of great resources.
Would you mind sharing some of those signs and tips of, youth using opioid for our viewers today?
So, something really important to know about opioids, we talked about the breathing slowing down, the heart rate slowing down, but really everything just starts to slow down when they take an opioid. So if your child, your teenager, seems like they are really sleepy, really tired, if they're nodding off, if they, aren't, speaking real coherently, if they're speaking more slowly, those types of things, just really the slowing down of anything, out of the ordinary for them. And it's not, based on a not getting sleep the night before, it definitely could be an opioid. So that's probably the easiest tip that I have as far as opioid use goes.
Right. Yep.
Mhm.
And so maybe the pinpoint eyes to looking at
Yep.
their, looking at them and talking to them directly,
Mhm.
looking for, are their pupils really, really
Yep.
dilated? How are they interacting with you in
Mhm.
your conversations? Are they
Yep.
acting a little bit different?
Mhm.
All those could, be potential signs of
Yep.
opioid use.
Yep. Just not being themselves.
Right. Yep.
Absolutely.
Absolutely.
Yep. All right. And then I did also want to let people know how they could get in touch with treatment resources. So I have a couple of different treatment locators here. On the web is a great resource, findtreatment.gov. It will find treatment based on any zip code in the United States that you plug in. So you will find all of the treatment resources, I believe within 100 miles of you, will pop up when you type in your zip code. And then by phone here locally, just pick up the phone and dial 211. 211 is a free helpline and it's confidential. It's available 24 hours a day, 7 days a week, and it helps individuals find local behavioral health resources, including treatment.
Awesome.
Yep. And so this is, I believe, my second to last slide. So I just wanted, again, to remind you of a couple things. Number one, when in doubt, administer Narcan. The wonderful thing about Narcan is it can save a life and it won't hurt anyone. We all could administer Narcan to ourselves right now and it would have no effect on us whatsoever. And that's why it is widely available to anyone and everyone. So we all can use it and we can be easily entrusted to use it because it is very safe. So when in doubt, administer Narcan and you could save a life.
Awesome.
And then lastly, this is my contact information. So if you as an individual or if your organization or group is interested in this training, as well as getting access to free Narcan, please contact me. And then I also just wanted to put our social media channels up there because there's a lot of information about overdose and opioids on our social media channels. I have a post 5+ days a week. So, and one to at least 2 a week address opioids, other drugs, overdose, things like that. So, if you're interested in more information about this, I definitely encourage you to get in touch with those resources as well. So, thank you.
Awesome. Yes. As we kind of come to a close here at the end of our webinar, and we'll take some questions. So you feel free to add them in the chat if you have any questions for Robyn about the presentation that you've just seen. Any specifics, things that Robyn can help answer, we can read them in the chat. So feel free to ask them right there in the chat. One thing that I kind of wanted to ask you and maybe have you touch on a little bit is how do we prevent, youth accessing these opioids.
Mhm.
That's one big thing that I think we've all seen, is the access to
Mhm.
them and how
Mhm.
easy they can
Yep.
obtain these medications.
Yep.
So, is there any
Yep.
tips that you can give, our audience today on how we can prevent these
Mhm.
opioids getting in the wrong hands?
Yeah, absolutely. So that is definitely a resource that I did not put up on the screen that I think is important, and that is our take back program in North Dakota. We have take back at almost all of our pharmacies, and we have it at all of our law enforcement agencies. So we recommend that you lock, monitor, and take back any medications that you have. So medications that you have, make sure that they're locked up so they are not easily accessible by youth. Um, Monitor them, make sure that everything looks right, that there aren't a few bottles missing or a few pills missing, and then get rid of any medications that are expired or no longer needed. Just take them to a take back location, and that service is free, and it gets rid of any excess medication. And if you go to the behavioralhealth.nd.gov/opioids page, there will be information there, including all of the take back sites at pharmacies and law enforcement centers throughout the state of North Dakota.
Great information.
The other
Yes.
thing I wanted to share too
Yes.
is that Fargo Cass Public Health has Deterra bags. And Deterra bags are medication disposal bags whereby you empty your medications into the bag. You add a little bit of water, you shake it up, you seal it, and then you can actually throw it in the garbage. It's safe to do that. Um,
Mm.
it is not it is not safe to just throw them in the garbage. It ends up in our landfills, in our drinking water, in our rivers. So we always recommend that you use a take back program, but this deactivates those drugs and takes care of some of those environmental concerns. So that's something too that if anyone is interested, I do have small, medium, and large Deterra bags for free. So contact me if that's something that you could use. I know that that is something that our public health nurses use for their clients that are homebound because they're not able to get to a take back program. So they work
Great.
really nice, especially for our seniors.
Yeah, a very convenient
Hmm.
option
Yep.
to
Yep.
dispose of medications. We do have a question here in our chat, and the question is, how long should each rescue breath last? And also, if recognizing an overdose is in a child versus an adult, is there any special considerations to take into account? That's a great question.
It is, and I don't know that I feel trained enough to answer the question about a small child. That would probably be a really good question for like our CPR trainers.
Hmm.
To ask them how should rescue breaths work with a child, because I'm not sure, so I don't want to give out any misinformation on that.
Sure.
Um, I would assume that the rescue breaths are going to be a little bit different because we're probably not going to they're not going to need as much
Hmm.
as we would want to give to an adult. um, but we would look to see the same kinds of signs, just sluggishness, slowing down of just all of their bodily functions. Would be what we
Sure.
would look for. But yeah, I would definitely need to refer the rescue breath question to more of a professional.
Sure.
Hmm.
And, as we're calling 911 too, the
Hmm.
trained operator on the phone
Uh,
will be able to guide us and help
yep.
answer some of those questions too, as to
Hmm.
how long you should administer those rescue
Yep.
breaths to a youth. Obviously, you're going to be sharing some of that information with about that
Hmm.
individual that you have come upon that is potentially suffering from an opioid overdose. So,
Great.
um,
Yes. Great answer. Very
yeah,
good.
yeah.
Yes. Those 911 operators know it all
Yes.
too. So, yeah.
Yeah, absolutely. Our next question is, can we have another event to take back prescription medications? I know with during times of COVID, it hasn't been very,
Hmm.
uh, you know, um, friendly to,
Hmm. Hmm.
host these type
Hmm.
events. But I know that coming up here in the spring and the summer, potentially we could look at something,
Hmm.
hosting an event.
Hmm.
And so the question is if that event could take place. And
Mhm.
I would assume, yes, we
Mhm.
could, put something
Yep.
together as a take back event for our community.
Yeah.
Yep.
Yep. Yeah. And we've, Fargo Cast Public Health, used to hold them, regularly, especially in the summer. And it brought out, I mean, we gathered like 200 pounds of
Mm,
medications at each event. And a lot of the people that brought them in, weren't familiar with the pharmacy or the law enforcement take back
mm.
locations, but they heard about the event or read about it. And so, yes, it is important to have those events periodically as well, just to heighten the awareness about that we do have take back locations and where they are and how they work and things like that,
Yep.
for
And then
sure.
again, sharing that message of the importance of, reducing access,
Hmm.
not only within your household, but, in
Yep.
the community as well. So
Yep.
they just don't get into the wrong hands. Yep.
Absolutely.
All right. Is there any other further questions? Feel free to add them to the chat. I think we are close to wrapping up here. As we come to a close again, I thank you so much for attending today's webinar. And I hope that you can join us for our next webinar, which is coming up on Thursday, April 1st. And we're going to be talking about social media and self-esteem. That is with BioGirls Executive Director Missy Heilman. And so we hope that you can join us for that. Please look for the event and how to register on Facebook at Level Up Fargo Facebook page, as well as Maddow Foundation's Facebook page. You can also find this information on our websites at levelupfargo.org and maddowfoundation.org. And I don't believe
Excellent.
there's any other questions, so we will wrap up today's webinar. I so appreciate having you come on and join us as a special guest today and sharing this important information. Um, you know, Being trained to administer Narcan and just having this knowledge, we all can play a role
Mhm.
in helping to save a life. So
Yep.
it's very important. I thank you again for attending today's webinar, and I hope you again join us next time, April 1st at noon. Thank you so much and have a great day.